Can I ask you something personal? Have you ever gone in for what doctors call a routine test, only to walk out with more fear than relief? If you are over the age of 70, this moment might sound familiar. I have spent more than 30 years as a neurologist, listening to patients who came for reassurance but left with anxiety. Numbers on a screen, medical words that sounded like a diagnosis when in reality, it was just normal aging. Those things often led to more pills, more scans, and even surgeries that were never truly needed. But I am not here to frighten you. I am here to give you back your power. In today's talk, I will reveal 5 common medical tests after age 70 that could quietly steal more from your life than they ever give, and I will share safer, simpler alternatives you can trust. So let me ask you, when was the last time a test result made you lose sleep? Was it truly helpful? Or did it simply make you feel fragile? If this message resonates, type number 1 in the comments. If not, type 0. Tell me where you are watching from and how old you are. I read every single comment with care. And if you believe your health deserves honesty and gentle guidance, please subscribe and ring the bell so we never lose touch. Your mornings matter, and so does your health. The hidden truth: overuse of tests after 70. Now let's uncover a truth most seniors in America never hear. Overtesting is one of the quietest dangers facing people over 70 today. Every year, millions of older adults line up for checkups, believing that more tests mean better protection, but the facts tell another story. Recent research shows that about 37% of medical exams in seniors lead to unnecessary treatments or long-lasting side effects. Think about that. More than 1 out of every 3 tests may actually cause harm instead of help. Even more troubling, 99% of people over 70 have no idea they are being subjected to excessive testing. Why does this happen? Part of the reason is habit doctors are trained to rule out every possible illness. Part of the reason is fear families and patients want certainty, and medicine often sells the promise of early detection. And part of the reason, we must admit, is financial testing is a multi-billion-dollar business in American healthcare. Yet here is what most doctors do not explain. Not all tests after 70 are equal. Some save lives when done for the right reasons, but many only create fear, trigger complications, and lead to hospital stays that weaken rather than strengthen. Imagine taking your car to a mechanic, and instead of checking the brakes or oil, he tells you he wants to replace half the engine just to be safe. You would never agree. Yet in hospitals and clinics, many older Americans are saying yes to invasive procedures that do not improve health. The good news is, there are better ways: gentle monitoring, simple lifestyle changes, and safe alternatives that keep you strong without putting you through unnecessary risks. I want to ask you something personal. Have you ever had a test you later regretted, something that caused more problems than it solved? If yes, share it in the comments. Your story may help another senior avoid the same path. Stay with me, because the first test we will examine looks harmless, just a quick scan with no pain, but it can quietly push healthy seniors toward unnecessary drugs and side effects. Let's start with the bone density scan. Bone density scan. The first test on our list is the bone density scan, often called a DEXA scan. On the surface, it looks harmless. No needles, no pain, just a quick picture that tells you if your bones are strong. But after the age of 70, this test often creates more anxiety than it prevents. Here is why. Bone loss is a natural part of aging, just like wrinkles or gray hair. Yet, when seniors take a DEXA scan, the results almost always show some degree of lower bone density, especially in women. That does not always mean disease, but many patients walk away with a new label like osteopenia and a prescription for powerful drugs. One of the most common medications is a group called bisphosphonates. On paper, these drugs are meant to strengthen bones, but in real life, they often cause jaw pain, esophageal irritation, and in rare cases, even jaw necrosis, where part of the jawbone begins to die. Studies have shown that in people over 70 with mild bone loss, the benefit is minimal. After 5 years, bisphosphonates reduce fracture risk by only 0.3%. A 2022 study in the Journal of the American Geriatric Society followed more than 1,200 women over 70 and found that the side effects were more common than the benefits. Let me share the story of Rose, a 76-year-old retired piano teacher. She walked every day, never had a fall, and felt strong. After a routine checkup, her doctor recommended a DEXA scan. The scan showed mild osteopenia, not osteoporosis. She was immediately prescribed alendronate. Within 3 months, she developed severe reflux and jaw pain, and she stopped playing piano altogether. When she came to my clinic, we discontinued the drug and instead focused on vitamin D, weight-bearing exercise with resistance bands, and a calcium-rich diet including sardines and leafy greens. Within a year, she regained strength, her balance improved, and she returned to performing recitals. Rose's case shows that for many seniors, lifestyle is the safer medicine. In fact, a 2022 study in Osteoporosis International found that targeted exercise, good nutrition, and vitamin D correction reduced fracture risk by more than 20%, far greater than the benefit of drugs for mild bone loss. So here is my advice. If you are over 70, strong, and not falling, be cautious before agreeing to a bone density scan. Do not let a number on a screen push you toward years of unnecessary medication. Focus on movement, balance, protein, and sunshine. That is what truly protects your bones. And now, let us move to the second test, one that frightens many families because it involves memory and the fear of Alzheimer's disease, the brain MRI. Brain MRI. The second test on our list is the brain MRI, often ordered when seniors complain of forgetfulness. Memory lapses are frightening because they raise the shadow of Alzheimer's disease. So what usually happens? A doctor hears about memory issues and immediately requests a magnetic resonance imaging scan of the brain. At first, this sounds reasonable, but here is the unsettling truth. Most MRIs in people over 70 reveal only age-related changes that are perfectly normal, such as slight shrinkage of brain volume or small white matter spots. These findings are so common that Neurology Today reported in 2021 that 86% of MRIs in patients aged 70 to 85 showed some abnormality, but only 3% were linked to a condition that could be treated. That means 97% of older adults ended up carrying fear, not answers. Even worse, almost 12% of patients went through invasive procedures like spinal taps or biopsies, all because of scan results that were not clinically meaningful. Let me share the story of George, a 74-year-old retired engineer. He was sharp, but sometimes misplaced his keys and forgot names. His doctor ordered an MRI, which showed white matter changes. George panicked, convinced he had dementia. He stopped driving, withdrew from church, and grew anxious. Yet when we reassessed him with a simple cognitive screening test, his scores were completely normal for his age. We explained that the MRI findings were just part of aging. Instead of focusing on the scan, we helped George build healthy habits, better sleep, hydration, and daily brain games. Within 3 months, he regained his confidence and his memory stabilized. The lesson is clear. For mild memory lapses, an MRI rarely helps. What truly helps is early cognitive screening, which is a simple paper and pencil test, inexpensive, quick, and without risk. This tool guides us far better than an MRI for everyday forgetfulness. Of course, if someone has severe symptoms like seizures, sudden personality changes, or rapid decline, then imaging may be necessary. But for most seniors, especially those just experiencing occasional forgetfulness, an MRI is more likely to create fear than to provide answers. My advice is this: do not let every slip of memory push you toward a tunnel scan. Ask for a cognitive screening first. Build a lifestyle that protects your brain with sleep, water, and mental exercise. And remember, your brain at 70 is not broken. It is wise, experienced, and still capable of growth. Now let us move to the third test, one of the most common in cardiology, the cardiac stress test. Cardiac stress test. The third test on our list is the cardiac stress test, one of the most common procedures ordered for seniors who complain of fatigue or mild chest discomfort. In this test, you either walk on a treadmill or receive medication that simulates exercise while your heart rhythm and blood flow are monitored. It sounds reassuring, but after the age of 70, the stress test often does more harm than good, especially if you do not have clear symptoms of heart disease. The main problem is accuracy. Studies show that false positives result suggesting disease when there is none can be as high as 40% in older adults. When that happens, patients are pushed into the next step: angiograms, stents, or even bypass surgery. A major study in JAMA Cardiology in 2017 revealed that more than half of stents placed after stress test referrals were unnecessary, providing no improvement in survival or quality of life. What they did bring were complications: bleeding, kidney damage from contrast dye, and extended hospital stays. Let me tell you about Raymond, a 75-year-old retired postman. He walked every day and was generally healthy. During a routine checkup, he mentioned that he felt a little more tired climbing hills. His doctor ordered a stress test just to be safe. The results suggested a blockage. He was rushed into catheterization, and because of a slight narrowing, a stent was placed. That evening, Raymond had a reaction to the contrast dye, which damaged his kidneys. He spent 6 days in the hospital and weeks in recovery. His fatigue never improved because it was never a heart problem in the first place. He simply needed more rest and hydration. This story is not rare. Across America, thousands of older adults are undergoing risky heart procedures triggered by false stress test results. If you are over 70 and do not have classic cardiac symptoms like chest pain on exertion, sudden shortness of breath, or fainting, a stress test may not be right for you. Safer alternatives exist. A resting electrocardiogram, or ECG, checks your heart rhythm while you sit quietly and carries almost no risk. A coronary calcium scan, a low radiation test, can show if dangerous plaque is building up, with far fewer false alarms. These options are less invasive and far more reliable for seniors without strong symptoms. My advice: before you step on a treadmill in a hospital gown, ask your doctor if there is a safer way to check your heart. Your goal is not more procedures, it is more mornings to enjoy with strength and peace. Now let us turn to the fourth test, the colonoscopy, which after 70 often carries more risk than benefit. Colonoscopy. The fourth test on our list is the colonoscopy. Most people think of it as a gold standard for cancer prevention. But after the age of 70, and especially after 75, the risks often outweigh the benefits. The procedure involves clearing out the colon with strong laxatives, then using a camera to inspect the lining of the large intestine. For younger adults, this can save lives, but for older adults, the preparation itself can be dangerous, causing dehydration, dizziness, and kidney problems. The sedation required for the procedure adds another layer of risk, especially to brain function in seniors. And the test itself carries dangers such as bleeding, tearing of the colon wall, or heart rhythm disturbances during sedation, A massive 2019 study published in JAMA Internal Medicine looked at more than 3 million Medicare patients over 70. It found that among those aged 75 and older, only 2 lives were saved for every 1,000 colonoscopies performed, while more than 20 people suffered serious complications. That is a risk-to-benefit ratio of 10 to 1, and many of the polyps removed at that age are small and slow-growing, meaning they may never have caused harm. Let me tell you about Dana, a 73-year-old grandmother who ran a bakery with her daughter. She had no symptoms, no bleeding, no changes in her stool, no family history of colon cancer. Yet her young physician strongly recommended a colonoscopy. She agreed. During the procedure, a small polyp was removed. That night, she collapsed with severe abdominal pain. At the hospital, doctors discovered a perforation in her colon. She spent 9 days recovering, lost 10 pounds, and was never the same. Later, we found she had already had 2 clean colonoscopies in the past. There was no reason for another. This is why the U.S. Preventive Services Task Force recommends stopping routine colon cancer screening at age 75. Safer alternatives exist. Stool-based tests such as the fecal immunochemical test, FIT, can be done at home without preparation or sedation and are still able to catch most concerning cases. They are simple, inexpensive, and carry almost no risk. My advice is clear. If you are over 75 and feeling well, think twice before agreeing to a colonoscopy. Ask your doctor about stool tests instead. Protect your health, your time, and your independence. And now, let us move to the final and most dangerous test on the list, the full-body CT scan. Full-body CT scan. The fifth and final test on our list is the full-body CT scan. It is often marketed as part of an executive health package or a premium preventive checkup. The pitch sounds tempting: scan your entire body, find cancer early, live longer. But here is the reality. Full-body CT scans expose you to a huge amount of radiation, often the equivalent of 500 chest X-rays in a single session. For older adults, that exposure is not just unnecessary, it can create new risks. A 2023 study published in JAMA Internal Medicine estimated that CT scans may now be responsible for up to 5% of all cancers in the United States, putting them on the same level as daily alcohol use as a cause of cancer. Think about that. A scan designed to catch disease early may actually create disease. And that is not the only problem. CT scans frequently find small, harmless things, tiny nodules, calcium spots, benign cysts that are simply part of aging. But once they are discovered, doctors cannot ignore them. This leads to more scans, biopsies, and surgeries, each with its own risks. Let me share the story of Marcus, an 80-year-old martial arts instructor who was still teaching younger seniors. He felt healthy and went to a private clinic for an elite senior checkup. His full-body scan showed a 3-millimeter lung nodule. That tiny finding triggered a cascade: referral to oncology, a PET scan, and finally a needle biopsy. The biopsy showed the nodule was harmless, but it punctured his lung, causing a collapse. Marcus spent 2 months recovering in the hospital. All of this came from a spot that would never have harmed him. This is why the American College of Radiology clearly states there is no evidence that full-body CT scans save lives in healthy people, and the potential for harm is significant. Imaging should be used only when there are real symptoms, such as unexplained weight loss, coughing up blood, or visible swelling. Scanning the whole body without reason is like using a landmine detector to look for treasure. You may find something, but the damage may be greater than the discovery. My advice is simple. If you feel well, trust your body and trust regular visits with your primary care doctor. Do not let fear push you into unnecessary scans. Save your health, your energy, and your peace of mind. Now we will close with a message that ties all 5 tests together and shows how seniors can protect their health with wisdom, not worry. Now that we have walked through the 5 tests, bone density scans, brain MRIs, cardiac stress tests, colonoscopies, and full-body CT scans, you can see a pattern. Each one was created with the hope of preventing disease, but after age 70, too often they bring more harm than healing. I have seen it countless times in my practice. Strong men and women in their 70s and 80s losing months of their lives to hospital stays, pills, or procedures that did not make them stronger. What truly protects health at this stage of life is not more scanning, it is wiser living. Eat real food rich in protein, calcium, and fiber. Move every day, even if it is just a walk around the block or light resistance exercises. Protect your balance with simple routines, like standing on one leg near a chair. Sleep well, drink water, and keep your mind active with reading, music, or community activities. These habits reduce risks of fractures, memory decline, heart disease, and even cancer far more effectively than unnecessary tests. Medicine is powerful, but sometimes less is more. Before saying yes to any test, ask your doctor one simple question. If this test finds something, what happens next? If the answer is uncertain or the risks outweigh the benefits, it may be wiser to say no. My friends, your time is precious. Your mornings, your laughter, your independence all matter more than another number on a screen. Let's build a culture of health that values strength, connection, and wisdom over fear. Now, I would love to hear from you. Have you or someone you love ever faced complications from a test or treatment that turned out unnecessary? Share your story in the comments. If today's message resonates with you, type number 1. If you are unsure, type 0. Tell me your age and where you are watching from. I read every comment and respond with care. And please, if you want more honest, gentle health advice for seniors, subscribe to this channel and hit the notification bell. That way, we will not lose touch. Remember, the first step in prevention is not another scan. It is choosing a lifestyle that nourishes your body and soul. Stay active, eat well, rest deeply, and choose your checkups wisely. Thank you for spending this time with me. May your years ahead be filled with strength, clarity, and peace.